The Plastic Surgery Guide to PDO Threads. PDO threads are used by many modern plastic surgeons and other practitioners to achieve impressive anti-aging results on male and female patients of all ages. But surprisingly, many people have never heard of the procedure or don't know what it exactly is. When patients want to turn back the clock without undergoing a knife, they often first think of facial paralytics like Botox or dermal fillers like Juvederm. These treatments are safe and effective and yield beautiful results when applied properly. But a PDO thread lift can often be used alongside of or in lieu of injectables to combat facial aging, to minimize lines and wrinkles, and to tighten up the skin and soft tissue envelope. If you have only mild to moderate skin laxity, or you just want to avoid the higher stakes and price tag of a full facelift, PDO thread lifts are definitely a non-surgical option worth exploring. What are PDO or polydioxanone threads? Polydioxanone or PDO threads are a special medical grade thread, a suture, that are much like regular sutures and are made in varying diameters and thicknesses. When larger PDO threads are used, the threads can be used as a lifting device in parts of the face and body. When smaller diameter threads are used, these threads are used for volumization, much in the same way that an injectable filler is used to create additional facial volume. In my practice, I use both lifting threads and volumizing threads. The term thread lift is used when the thread is inserted to create lifting of soft tissues. The interesting thing about these threads, there are microbarbs that are welded to the suture, to the thread itself, so that these small barbs can keep the tissue from falling in the same way that it was. I explain this to my patients as though the barbs on the threads are like those metal parking lot devices that prevent drivers from re-entering or re-exiting a parking lot after going in the other direction. Let me explain. Imagine you're leaving a parking lot and you're driving over the angled metal teeth that prevent you from re-entering the parking lot. What we do with these barbs is to place these underneath the skin, and then we pull the skin up so that the skin cannot move back over the barbs. The skin sort of sticks to this. It prevents it from descending. The only difference is that instead of large pieces of metal, the microbarbs are suture material that are welded to the actual thread or suture. With a PDO thread lift, lidocaine or another numbing agent and an anesthetic agent is first injected at the threading site so that the patient feels little to no pain during the procedure. Then the PDO thread is inserted into the skin. It's not really stitched, but it's inserted underneath the skin, the subcutaneous fat, lifting up the muscles and the soft tissues, and so that the target area is lifted. When done by an expert, the PDO threads will not be visible, and they'll dissolve naturally over time. The normal time is about 12 months, but it depends on the thread and the patient. The PDO threads act as a sort of mini facelift. They can help to correct sagging skin, they can relax the muscles that cause wrinkles, and they stimulate the body's natural production of collagen, elastin, and hyaluronic acid. The benefits of PDO thread lifts are many. The stitching itself gives a slight natural-looking lift to the facial features. Meanwhile, the substances in the threads and the microtrauma from the procedure prompt the body to create more of its own age-defying resources, such as collagen, at the threading site. The result is firmer, younger-looking skin that is lifted up with reduced sagging and wrinkling. Different types of PDO threads are used for different purposes. Barb threads are used to lift, whereas twist threads and smooth threads are used to add volume to sagging areas, depressions, or deep creases. We use these in the cheeks, the lower eyelids, and even in the nose. Smooth threads can help fix more superficial lines in thinning or crepey skin. An expert PDO thread practitioner can use a combination of threads on different areas of the face and neck to achieve the patient's desired results. Patients asked, what's better, PDO threads or fillers? PDO threads can be used alone or in combination with dermal fillers or botulinum toxin. A combination of different treatments are often used together to achieve maximum non-surgical facial rejuvenation. So PDO threads versus fillers is not an actual question that I like to answer. That said, fillers are best for areas that require added volume, like the lips. Products like Juvederm and Restylane are popularly used to augment the lips, the cheek, the chin. Results are immediate, and there's no recovery time. Fillers are needed to be injected every 6 to 9 months. Some newer formulations are even longer lasting. PDO threads, by comparison, are used more for lift than for volume. While the threads can plump up and firm the skin by stimulating increased collagen, they generally do not add actual volume to the treatment site. If you want to create the appearance of fuller cheeks or lips, filler is your best option. If you're going for overall facial rejuvenation rather than feature modification, a PDO thread lift may be a better bet for you. Do these threads dissolve? This is an interesting thing. Yes, they do dissolve. The initial threads that came out were permanent sutures, and there were a lot of problems with them. But PDO threads are made of biodegradable material today that dissolves on its own within 12 weeks so that the absorbable sutures will not need to be removed once they've been placed. You'll see some noticeable difference immediately after the procedure, but it will take about 10 days to 2 weeks for this to truly show up. This is when the process of natural protein synthesis starts to occur at the threading site and along the path of the thread. The additional collagen, elastin, and hyaluronic acid produced by your own body starts to revitalize the sagging skin, giving it an extra firmness and structure that all of my patients like. The appearance of fine lines and wrinkles start to diminish. Results will continue to gradually improve after a PDO thread lift, usually peaking at about 6 months and lasting anywhere from 1 to 2 years. So in terms of non-surgical anti-aging treatments, PDO threads offer patients intermediate lasting results with no anesthesia risks and no lengthy recovery time. A big question is, are PDO threads as effective as surgery? PDO threads do not work as well as traditional surgery. I'm here to tell you that. And there's a reason for this. In surgery, we make an incision and we cut across the entire tissue plane and we separate the tissue plane. PDO thread lifts do not separate these planes. However, the advantages of PDO threads include lower cost, less downtime, and virtually no scarring. The patient only needs to know that the PDO thread is not going to work as well or as long as traditional surgery. The lasting time is related to when the thread dissolves and when the patient's skin resags. Most PDO threads dissolve completely within 12 to 18 months. Do you have questions about this or anything else? I'd love to help you. Call or email me today. I look forward to seeing you in my office. Thanks.